Hello, I'm Dr. Dennis McKenna. Today I'm joined by Fran Albert, our CFO, COO here at Albany Medical Center. Welcome.
Thank you so much. Nice to be here, Dennis.
We're gonna chat a lot here this morning. Today is Tuesday, September 22nd, giving you the update from Albany Medical Center. So, Fran, we're going to jump into the COVID numbers first, just to begin. These look the same as they have now for quite some time. Capital Region, the 8 counties, there are currently 17 people in the hospitals of those 8 counties being treated for COVID. Interestingly, that is the lowest number that we've ever recorded. So since we started counting March 27th, that's the lowest number.
That's great news.
That is great news. And that inside here at the Medical Center, next graph, admissions above the line, discharges below the line. You can see we had an admission yesterday. So if you go inside the house here, we currently have 5 in the hospital. Again, that's a very low number compared to where we were in the past. 3 on the floor, 2 in the ICU, and none on ventilators. So great news. Continues to be great news for among our workforce.
And very low incidence in our workforce.
For sure, for sure. So typically, Fran, when we have guests, I'll say, tell us where you're from. But I know where you're from. You're from Voorheesville.
Yes.
Yes, you are. And then you went to the University at Albany.
I did.
And how long have you been here at Albany Medical Center?
I have been here 20 years. I celebrated that anniversary end of July.
Outstanding. All right, we're going to play a game here. You have to answer this in the form of a Jeopardy question, okay?
Okay.
So I'm going to name these things and then answer it. Ready? So here's the topics. Finance, HR, facilities, engineering and construction, security, communications, and development. What do they have in common?
They are the teams that I have the absolute honor to work with.
So tell us about that. That's quite a portfolio to have. So
yes.
Obviously you can't speak about all of them, but just speak about the role that you play here.
Absolutely. So when I first started Albany Med, I came into the finance team as Vice President for Finance, in charge of all the financial reporting, tax reporting, payroll, accounts payable. And over the years, I got to know more and more people throughout the organization, get more comfortable with other operations outside of finance, and have expanded my role over time. A few years ago, took over as the Chief Financial Officer, and then a little less than 2 years ago also became the Chief Operating Officer. And that is when I started to work with teams such as Human Resources, the security team, Facilities, Engineering and Construction, the Foundation, and the Marketing and Communications team. And it's been an absolute honor to branch out into those areas and work with those tremendously qualified professionals.
I mean, I think for those who don't know Fran, they can see she has this incredible optimism to her. And those are 2 incredibly huge roles to have, Chief Financial Officer and Chief Operating Officer at an academic medical center. And you do such a great job with it.
Thank you. One
of the areas you mentioned was security. Now it's National Security Officer Appreciation Week. We had the pleasure of having Mr. Charles Day with us last week. And I think you wanted to say a couple things specifically about our security officers.
Yes, thank you, Dennis. I just want to thank Charles Day and his team. They are wonderful, wonderful professionals. They live and breathe the medical center, the workforce, and the patients. They are so true to their mission and so committed to it each and every day. I don't ever have to worry. We're in constant contact, but none of us have to worry. They keep this entire environment safe, and they keep all of us, all of our loved ones, all of our patients, and any family members who come here, they keep them all safe.
They do. Mr. Charles Day, myself, and you, there's a triangle text message that goes on almost on a daily basis where Charles gives us an update what the status is on the campus, anything related to security, for sure.
And it's been such a pleasure to work more closely with that group over the last couple years and start to learn the discipline that they have to follow and stay true to day in, day out. And they do an incredible job.
They do. I'm so glad you're with us today because it follows yesterday's messenger about every member of the workforce having 2 additional days of PL given to them. And I'm glad you're here because I think the workforce needs to know, Fran, that was your idea. You're the one that came up with that idea. So talk about that. It was, I'll say, an easy decision for me to make because it's a great way to recognize our workforce, but you get the credit for bringing it up. So why did you want to do it?
Thank you for saying that. It has been a very challenging year for everyone, and in so many ways. We know all the things that we have faced here at the medical center, and people have done so completely selflessly. But what has happened with respect to travel restrictions and social distancing, many of us have not had the time to spend with our families that we would like to spend with our families, to travel to see friends or other loved ones who aren't in the area. There's challenges with school schedules, there's challenges with various work schedules. It's been challenging, to use that word again, but it's been challenging in terms of financials as well. You've heard me talk about that month in, month out. However, we wanted to give back, and we wanted to give something to our workforce that wouldn't be imprudent from a financial standpoint, and would hopefully give something back to the workforce that was meaningful. And time with your family, friends, and other loved ones, that seems to be the most meaningful thing we could give you.
Yeah, for sure. And one thing that we both agreed upon is it was a way to recognize every member of our workforce.
Yes.
Frontline providers are incredibly important. The people who support them are also equally important. So, as I've said before, if you're on the front line delivering care, the PPE you wear has to be sourced by somebody, and it has to be brought from the warehouse to the bedside, and that requires non-clinical people. And I can give so many other examples where non-clinical people and clinical people both together, very important. So that was the way. So again, I'm sure the workforce thanks you for advocating for them, and I certainly do as well.
Thank you for supporting.
For sure. Another thing I know about Fran is she loves to run. She's a runner. So I know that she is going to be doing the Steps for Kids. You may have seen the messenger yesterday. So this is a 5K. It's going to benefit the Bernard and Millie Duker Children's Hospital at Albany Medical Center, and it's actually going to be a virtual run. That's the way things are these days. And it's going to take place on Halloween, October 31st. I want to thank Jamie Bicchetti and Sarah Ridnello and James Kellerhouse and many others who pulled this together. So I've registered. All 6 members of my family are going to either run or walk it. And I know you're going to do it.
Yes, I am.
And so anyway, look for that. Steps for Kids. Very important that we do that.
I'm actually a sprinter, but I'm not going to sprint a 5K.
Sprint and walk. Last thing for me, and then we'll let Fran give some closing comments as well. This Thursday, we're going to have the pleasure of having Dr. Antonikowski with us.
Yes.
So she is our new Chief Officer of Health Equity, Diversity, and Inclusion. So look forward to talking to Dr. Antonikowski on Thursday. Fran, any closing comments?
Just want to say how proud we are that she accepted that position, and that we have that position here at Albany Med, so important to our entire workforce and to our community. Wanted to remind everybody that at the end of the month, the plan is to go live with Workday, which is our new payroll and human resource management system. Keep your eyes and ears open for announcements with respect to whether it be updates to core systems or other important information that you need to know about that go live. But just want to thank the entire workforce, want to thank Dr. McKenna for having me today, and wish you all the best, and turn it back to Dr. McKenna.
Thank you. We're going to have you back.
Okay.
Fran's a natural. Fred better watch out. You better watch out. So we will be back again on Thursday. We ask that you please, once again, take care of yourself, take care of each other, and we'll see you on Thursday.